Hi, I'm Casey Adams Jones, Communications Director for the American Heart Association. For nearly a century, the AHA has championed health equity for all people, and we are more determined than ever to eliminate racial and class disparities by redoubling our commitment to overcoming barriers to health and social inequities. We must stand together as a relentless force for a world of longer, healthier lives. That is our mission and our contribution to a more equitable society. I'm thrilled to be joined here today by Jennifer Lynchman Green, Vice President of Health for the AHA in Southeastern Pennsylvania. She's going to share an overview of the efforts her team does to address some of these disparities, and also how individuals and organizations with a heart to help can get involved. Hi, Jennifer.
Hi, thanks so much for having me.
Thanks for being here today. How about we kick off with you sharing a little bit about the work your team of staff and volunteers do here at the AHA in Southeastern PA?
Absolutely. So in my role, I oversee the American Heart Association's work in advocating for local public health policy, as well as our work alongside communities across the region to improve health and well-being for all. And I've been with the AHA now for about 7 years, and it's been really incredible to see how our organization has pretty rapidly been able to evolve to better address the specific needs of local communities while remaining rooted in our history of heart and brain health. So many of us know that 80% of our health outcomes are determined by where we live. And we at the American Heart Association, like many others, are on a mission to change this trajectory. And the community impact model of the AHA, which is having local staff dedicated to policy, systems, and environment changes at the local level, really came about because of our dedication to addressing health inequities.
Thank you, Jennifer. I'm quite sure the team here has been busy wrapping up another year of health impact work. Can you talk about some of your top reflections as you think about the impact made over the past year?
Yeah, this has been an incredible year to be part of the AHA and to see so much progress being made, and yet to know how much work there is remaining. So we started the year really strong, working alongside community partners in our priority neighborhoods, and we were able to pass a bill in Philadelphia which will ensure that all kids' meals served within the city will now include a healthy beverage as the default option. The AHA's annual Scientific Sessions Conference came to Philadelphia for the first time this fall, and we were really proud to work alongside the School District of Philadelphia to bring over 100 high school girls to the event, to learn from women who have found success and fulfillment in the fields of science, medicine, public health, and research. We know that building diversity and inclusion within these fields is critical, and we are committed to playing a role in bridging that gap. We convened a social impact task force in Philadelphia, a group of volunteers charged with guiding the AHA's ongoing work in the community and identifying opportunities to empower communities to change their own trajectory of health and well-being by addressing issues of economic growth, healthy food access, housing, and educational opportunity through the AHA's Social Impact Fund. We were also able to be very present in the community during the first part of this year, providing cooking and nutrition education to shelter staff from across the city, also providing the equipment needed to support the preparation of healthy meals in shelter settings, providing meals for students during planned days off from school, and working alongside staff from federally qualified health centers. So these are health centers that serve the underinsured and uninsured populations to improve standards of care, as well as patient and family engagement. These are really just a few examples that I wanted to share today and highlights of the work that we were able to accomplish earlier in the year. I do want to say, lastly, how proud I am of this team of staff and volunteers for the rapid response and adjustments that we've been able to make in response to the COVID-19 pandemic. The way in which we do our work has certainly changed, but our commitment to our mission and more importantly to our community, has only grown stronger.
Thank you, Jennifer. Your mention of the COVID-19 pandemic is actually a great segue to my next question for you, which is many organizations are stepping up in response to the COVID-19 pandemic. Can you share some of the AHA's efforts and also what's differentiated our work from that of other organizations?
Yeah, what I would say here, Casey, is that we have, at all levels of the organization, activated our full organizational strength to combating the spread of the coronavirus and to address the vulnerabilities of heart and stroke patients, caregivers, frontline workers, and other vulnerable populations. Our local team has remained closely connected with our partners from city agencies, schools, community organizations, and health centers in an effort to identify gaps, needs, and opportunities for us to play a role and lend a hand during these times. We have also remained very closely tied to what we have identified as our two critical ongoing areas of impact, which are increasing access to healthy foods and increasing access to care. In March, we were able to quickly identify and follow through on a couple of immediate opportunities that are still ongoing during this time. To address the increase in food insecurity and lack of access to healthy foods, we were able to facilitate the distribution of freezers to 20 food pantries from across the region, helping to provide an additional 12,000 frozen meals to families in need. We made adjustments to a program that we had planned alongside an urban farm in North Philadelphia, transitioning that program into a weekly produce farm stand and delivery program serving 50 families. We were able to identify food delivery gaps and facilitate connections to help to fill those gaps, providing thousands of pounds of rescued food to a shelter in Southwest Philadelphia and a workforce development program. To address the gaps in care that seemed to be exacerbated by the pandemic, we expanded our ongoing support of community health centers to provide blood pressure cuffs and health education resources to their most high-risk hypertensive patients. So these tools will allow these patients to monitor their conditions safely from home while receiving telemedicine support from their provider. And to answer the second part of your question, I would say that what makes the work of the American Heart Association so unique is that we are an organization with a long history of science and research, and we are able to bring our evidence-based resources and interventions to the community while working alongside our community partners and community members to identify additional ways for us to support and collaborate. Our hope is that these evidence-based interventions and community collaborations will lead to more opportunities for everyone in all communities to live a long, healthy life of opportunity and enrichment.
I'm sure there are volunteers, supporters, and some of our many friends of the AHA who are watching this video, and they might be wondering, how can I help on a personal level, or how can my organization get involved? What would you say to them?
What I would first say is that it is so clear that our mission is more important now than ever before. And more than ever, we need your help. We need our volunteers to help us and guide us as we navigate through these incredibly challenging, yet incredibly important times. Whether it is by helping to facilitate new connections, helping to spread the work about the message about the important work of the AHA, or supporting us with a financial contribution, we so much appreciate and so much need the support at this time. The AHA has not been immune to the economic impact that so many of us are feeling due to the COVID pandemic, and we need your support in order for us to continue our work of saving and improving lives. The team of staff and volunteers has worked so hard to achieve the financial goal that we need to achieve in order to expand and continue much of the work that I've shared with you today. So if you're watching and if you're in a position to make a financial contribution, I ask that you please consider pledging your support of the American Heart Association today. Your gift will save and improve lives.
Thank you so much, Jennifer. Thank you for your thorough answers and giving us insight on the hard work you and the team have been doing, as well as how others can support and be part of our life-saving mission. Again, I appreciate your time today, and thank you to those of you who are watching this video. If you feel inspired by what was shared today, but are not sure what the next steps are, definitely contact your local AHA representative. As always, Jennifer and the staff here in Southeastern PA are happy to answer any questions that you have about our work. We hope you and your families stay safe and stay well.